Okay, now we want to review this. This is a great synopsis of what the American Heart Association and Stroke Association had let forward. So the top 10 things to know. The importance of assessing cardiorespiratory fitness in clinical practice. A case for fitness as a clinical vital sign, doctors. Okay, so the first one is, we'll make it a little bit bigger so we can see it. Cardiorespiratory fitness is a reflection of overall physiological health and function, especially the cardiovascular system. Many factors can contribute to CRF, including gender, age, race, ethnicity, and genetics. Regular physical exercise is a behavior that can contribute to improved CRF. CRF is an independent marker of risk for cardiovascular disease and all-cause mortality. It is a stronger predictor of mortality than established risk factors such as cigarette smoking, hypertension, high cholesterol, and type 2 diabetes. This would mean, guys, that this is the strongest predictor. So out of all of the tests that we have out there, when we talk about general health overall, excluding obviously if someone gets a cancer diagnosis, a massive heart attack. No, we're talking about what is the best predictor of your overall health and where you're at. And this would be at V02 max testing is the strongest predictor of mortality. Number 3, CRF can be expressed in several ways, including METs. Lower CRF in adults is associated with higher risk of cardiovascular mortality, whereas CRF levels of greater than 8 to 10 METs are associated with increased survival. More than half the reduction in all-cause mortality occurs between the least fit group, under 5 METs, and the next fittest group, 5 to 7 METs. Suggesting that individuals don't have to become elite athletes to benefit from increased CRF. Small increases in CRF are associated with considerable 10 to 30% lowered risk in cardiovascular events. What a great line. What a great line. Okay, the scientific statement. Oops, sorry. I don't like it when it does that. All right, number 4. The scientific statement reviews the current available data linking cardiovascular fitness to cardiovascular and overall health and establishes the foundation to incorporate cardiorespiratory fitness measurements in standard clinical practice. Number 5, in addition to improved cardiovascular outcomes, higher levels of CRF are associated with improved outcomes for certain forms of cancer, surgical risk, dementia, Alzheimer's, depression, type 2 diabetes, and metabolic syndrome. And I've noticed that a lot of the cancers tend to be reproductive cancers. Number 6, the potential mechanism for the independent adverse associations are not yet fully understood. However, the benefits of improving CRF are greater for those at the lowest CRF, suggesting that some physical activity is better than none, especially for habitually sedentary individuals. So one of the things they're saying here is they're not sure of all the mechanisms that when you improve your cardiorespiratory fitness, all the mechanisms of how that offsets disease and mortality. But they do know that it occurs. And then in this particular sense, they also notice that those who have the lowest cardiorespiratory fitness often can get some of the best results, even if it's not habitual exercise. That there's some. So the increasing in cardiorespiratory exercise definitely increases or lowers their risk level. Okay, number 7. Increase in CRF by even 1 MET is associated with 10 to 20% decrease in mortality rates. That is crazy. If you'll notice on the treadmill and some other exercise bikes, they tend to measure METs, which is a measurement of how much energy is expended during exercise. So just 1 MET is a 10 to 20% decrease in mortality. Amazing. To decrease CV risk, physical activity regimens should be implemented with an initial target of increasing cardiorespiratory fitness by over 10%. That's awesome. I experienced that. We've seen Mary Ellen experience that. So that would mean that we definitely want to have exercise prescriptions and training. Another area for all of us to have appointments with patients. Okay. Number 8. While both high-intensity interval training, HIIT, and moderate-intensity continual training can be effective for increasing CRF, results across studies are inconsistent when comparing the effects of HIIT and MICT on increasing. Although HIIT may be as safe as MICT for patients with cardiovascular disease, more data is needed. I think the question that's being raised there is that if we have heart patients, cardiovascular disease, congestive heart patients, maybe heart valve issues, the question is, can HIIT still be applicable to them, where we're looking at getting their heart rate much higher for a small amount of time? Okay, number 9, cardiopulmonary exercise testing, CPX, which is what the cardiologists do, which is almost exactly like V02, except they have catheters entered into the arteries to measure oxygen and CO2 right at the arteries, is considered the gold standard for assessing exercise capacity. V02 is the gold standard. However, other methods are available to estimate CRF, including submaximal exercise test protocols, the 6-minute walk-in test, and the non-exercise prediction equations. These alternative methods have less precision than CPX testing, but may be more readily available in certain clinical situations. Care should always be taken to select a protocol that matches the individual's exercise and functional capacity. And we talked about protocols earlier, so hopefully we'll grow in those protocols over the next couple of years. And CRF metrics to risk classifications presents health professionals with unique opportunities to improve patient management and to encourage lifestyle-based strategies designed to reduce cardiovascular risk. These opportunities will help optimize the prevention and treatment of cardiovascular disease and hence meet the AHA 2020 goals. So there you go. We have by far one of the best tests, if not the best, for risk stratification, for getting exact measurements on the level of cardiorespiratory fitness, a way to evaluate their current health status, and then having a prescription where we can see them improve their health. This is so awesome. Okay, so one more study let's take a quick look at. This is obviously lack of exercise, a cause of chronic diseases. This is also listed in our website under resources. It would be right here. Lack of exercise, cause of many. This is a great study. I love this study. It's 167 pages, I think. 135 it says up here. But let me just read this part and we'll close this idea. Chronic diseases are major killers in the modern era. Physical inactivity is the primary cause of most chronic diseases. The initial third of this article considers activity and prevention definitions, historical evidence showing physical inactivity is detrimental to health and normal organ function capacities, causes versus treatment, physical activity and inactivity mechanisms different, gene-environment interactions, including aerobic training adaptations, personalized medicine, and co-twin physical activity, and specific da-da-da-da-da. I know, right? It goes on and on and on. All right, let's pick up where it says next. Next, physical activity, exercise, is examined as primary prevention against 35 chronic conditions. Let me read that one more time. Next, physical activity or exercise is examined as the primary prevention against 35 chronic conditions. Accelerated biological aging, premature death, low cardiorespiratory fitness, VO2 max, there we go. Sarcopenia, metabolic syndrome, obesity, insulin resistance, prediabetes, type 2 diabetes, non-alcoholic fatty liver disease, coronary heart disease, peripheral artery disease, hypertension, stroke, congestive heart failure, endothelial dysfunction, which I think is cardiovascular, the arteries, arterial dyslipidemia, high cholesterol, hemostasis, deep vein thrombosis, cognitive dysfunction, depression and anxiety, osteoporosis, osteoarthritis, balance bone fractures, rheumatoid arthritis, colon cancer, breast cancer, endometrial cancer, gestational diabetes, preeclampsia, polycystic ovarian syndrome, erectile dysfunction, pain, diverticulitis, constipation, and gallbladder disease. Now, what a list! So I'm going to hold here because I got to find another part in this, if I can find it real quick. Is the article is not only saying this is prevention, the article goes on to say that the actual physical inactivity is the cause of diseases. An underappreciated primary cause of most chronic conditions is the lack of sufficient daily physical activity. Overwhelming evidence proves the notion that reductions in physical daily activity are the primary causes of chronic diseases and conditions, and that physical activity exercise is rehabilitative treatment therapy from the inactive cause of dysfunction. So he's saying not only does physical activity help prevent these diseases, but physical inactivity is the cause of these diseases. Sorry, I said that wrong. Physical activity can help prevent these 35 chronic diseases. By the way, which these 35 chronic diseases make up 80% of our deaths in the United States or more. So physical inactivity is the cause of these. That will be the argument that goes through this article. It is really an excellent article. I would encourage you to take a look at it. And we'll stop there because this video is too long already.